Hi, my name is Anaya and I'll be teaching you the proper way to shampoo a patient or resident in bed. So first you want to always do proper hand hygiene. Once you have done proper hand hygiene, you want to go ahead and provide privacy for your patient. Then you want to gather a bit of information on your care plan as well. You want to make sure you know what type of products you'll be using on your patient. You want to know what procedure, what method you'll be doing, on the temperature of the water. You want to make sure you also know if your patient has any skin condition, any scalp condition, or any safety measures you need to take. Once you know your information and what equipment to use as well, you want to go ahead and you want to greet your patient, and you also want to introduce yourself. So would you say like, "Hi, my name is Anaya. I'll be the nurse assistant today, and I'll be assisting you with shampooing your hair in bed." So obviously you want to tell the patient as well everything that you'll be doing. You want to explain everything you'll be doing as you're doing it to provide like your patient to be more comfortable. You also want to make sure to continuously ask your patient how are they feeling, are they okay, are they comfortable, and things like that. Okay, so then you want to go ahead and put on your gloves if necessary. So it's important to wear gloves if your patient has like any scalp conditions, any sores or open skin in their scalp. You want to make sure to wear gloves. Once you have your gloves on, you want to go ahead and you want to grab a towel to put on over your patient. In this case, I do not have a towel, and I apologize for the circumstances. I'm using examples that I have at home, so I hope I could explain that at the best of my ability. So you want to go ahead and put a towel over your patient to prevent them from getting wet. And you also want to make sure that under the patient there is a waterproof pad. You then want to tell your patient that you would be putting a towel under their head to avoid them getting wet. So you want to grab your patient's head and you let them know you're grabbing their head and you'll be supporting it. You want to remove the pillow. You want to go ahead and grab the towel and place it right under the neck area. Once you have done that, you want to tell your patient that you will be grabbing the shampoo head. It's like a basin that you obviously have the more proper equipment and professional environment. In this case, I'm using a bone, and you want to put it right under the patient's head. Then you want to go ahead and you want to check the temperature of the water, and you want to also allow your patient to test the water. And if your patient has any preference on the water, you may change it. So I'll be using this as my example of rinsing the hair. So you want to first slightly damp the hair, rinses it just slightly, just to make sure like the hair is like wet, so you have, when you shampoo it, could lather up. So then I'll be using this as my example of shampoo as well. So you want to go ahead, grab shampoo, make sure it's the right correct shampoo to use on the patient. You want to let the patient know that you will not be putting the shampoo in their head in a circular motion. You want to you never want to use your fingernails. You want to use your fingertips around the scalp, making sure that you do it gently, but also put enough pressure to get all the oil and debris from the scalp. You want to make sure you're scrubbing. Make sure to ask your patient continuously if they're comfortable, are they feeling okay with what you're doing to them. You always want to make sure your patient is feeling comfortable. Never forget about the back of the head. You want to support the head and rise the head up, and then you want to also get the back of the head with the shampoo. you want to make sure to get shampoo on all surfaces of the head, on the scalp, and you want to evenly spread out the shampoo. Once you have successfully cleaned and lathered up the shampoo and the entire scalp, and you think it's time to rinse off the shampoo, you want to go ahead and grab your water that you'll be rinsing with. You want to make sure to rinse the hair. And you want to make sure to go under the head as well. You want to make sure to get all the shampoo out. Once you have successfully rinsed off all the shampoo, you want to go ahead and let your patient know that we are done rinsing. Now will be you ask your patient if they want to dry the hair. So now you can remove the gloves. An important step that I did forget to mention, because I don't have the proper equipment, is before you start shampooing the hair, you want to make sure, you know what, we're gonna do this again.